I think hello everybody. Welcome. We're letting everybody into the Zoom meeting. So as we all get together, we'll begin in a minute here. So thank you very much. Hello everyone and welcome to this webinar, Beyond the Blueprint for the Visual and Performing Arts. My name is Rachel Osajima and I'm the director of the Alameda County Arts Commission. I would like to begin by saying thank you to everyone who is joining us today. I would also like to say thank you to the Alameda County Healthcare Services Agency for presenting this webinar and for working with me and the arts community throughout the pandemic. Your leadership is so very much appreciated by our whole community. The work of the Alameda County Arts Commission is based on the belief that arts, culture, and creativity is an essential part of every successful and thriving community. And we all know how important the arts are. While during the pandemic, the arts have continued to provide thoughtful dialogue, community building, and hope. We also know how devastating the pandemic has been for our whole arts ecosystem. As we celebrate this week's important reopening milestone, I believe we are all excited and hopeful that many organizations and businesses that have struggled to survive during these challenging times now have a chance to recover. At the same time, we do not forget the tremendous loss that so many people have experienced during the pandemic. So I want to say thank you to each and every one of you and to the whole arts community for your ongoing dedication and hard work. Now I would like to introduce the awesome team at Alameda County Healthcare Services Agency who organized this event and who are presenting this information. We have Ieshia Sheppard, the co-deputy of COVID-19 Information and Guidance Branch. Pegah Shahmirzadi, COVID Workplace and Recovery Specialist. Eileen, Policy Director and Recovery Unit Lead. And Bo Woodson, COVID Workplace and Recovery Specialist. So a few notes. A number of arts organizations have asked me if this webinar will be recorded. Oops, my phone's ringing. And yes, the Healthcare Services Agency is recording this session. Once it is posted online, I will send a follow-up newsletter and email to all of the Arts Commission's contacts with a link to the recording. And I know that my partners and city level Arts Commissions and Councils will also be sharing that information in the link. Also, we have collected questions in advance and the Healthcare Services Agency staff will provide answers at the end of the presentation. And all of you can also use the question and answer function of the chat to ask questions in real time during this session. So now I would like to hand it over to Ieshia.
Thank you, Rachel. So as a bit of housekeeping, this session is scheduled from 1 p.m. to 2 p.m. So we are going to be respectful of your time. All participants are currently muted, which means that you won't be able to talk. But there is a Q&A function that's enabled at the very bottom of your screen. We will work to answer those questions throughout and at the very end of the presentation. As Rachel told you all, the event is currently being recorded and a copy of the slides will be made available to you all within 24 hours. Last but not least, you will notice a little symbol. It looks something like a light bulb with an exclamation mark in it. So the purpose of that symbol is just to highlight FAQ, so frequently asked questions that we observe throughout. So wherever you see this, I'm really going to just stress the point because we got a lot of questions around that. So you'll see that throughout today's presentation. For today's agenda, we will cover local COVID-19 data, beyond the blueprint and what exactly that means, Cal Osha requirements, tools and resources, and then we'll go into the question and answer segment. So I'm going to get us started with the local COVID-19 data. But before I do that, I'd like to just provide an overview of COVID. It's been with us for some time now, a little over a year has been this state of emergency. But I just really want to remind us what exactly COVID is and what exactly it means. So COVID is a respiratory illness that ranges from mild to very severe. It's mainly spread through the air from person to person when an infected person coughs, sneezes, or talks. There are some common symptoms that I'm pretty sure you're familiar with, so I'm not going to belabor that. I will not read those to you. You can see them on the slide. But the part that I'd really like to stress is the bolded part that you see. The virus has not gone away. The pandemic is not over. So I just would like you to consider that as we work to go back to normal, or whatever normal could look like for us after this pandemic. So just as a high level overview of the data slides, so this comes directly from our data dashboard. If you are interested in seeing more data or playing with the functions of that, we will provide you the link to the database. But here, I just want to highlight the fact that in Alameda County, including both Alameda County and the city of Berkeley, there has been a total of 89,446 cases of COVID-19, and that includes 1,272 deaths for our county. There has been 78.7, so close to 80% of people 12 years old and over who have received at least one dose of vaccine. So I want to bear in mind that vaccination is truly what has gotten us to move through the less restrictive tiers. And this is really what has gotten us to be able to be where we are now, where we're moving beyond the blueprint. So you might ask, like, well, what exactly is this moving beyond the blueprint thing you're talking about? What is beyond the blueprint? So beyond the blueprint means most COVID-19 restrictions have been lifted, effective yesterday, June 15th. So I'd like to let you know that Alameda County and the city of Berkeley are fully aligned with the state of California at this time. So everyday life will feel a bit like it did before COVID. So employers are still subject to restrictions, however. So we'll talk a little bit more about this later. But again, I just want to highlight that everyday life will feel a lot like it did before COVID, but that there are some additional restrictions and just rules and regulations as per Cal OSHA. And then the last thing, as I stated on my previous slide about the pandemic not being over, I really want to drive this point home, because we'll need to work together just to make sure that we're protecting our most vulnerable community members. So just pointing out that masking will still be required in certain situations and settings, and we have a slide that we'll go through and point out to you exactly what those masking requirements look like going forward. So the next question you might have, you're like, okay, so now I'm clear on what beyond the blueprint means. Well, what restrictions have changed? So this table here is an illustration of what exactly it's looking like for us going forward, or at least for right now. So capacity limitations, there are no more restrictions for that. There are no more capacity restrictions. Physical distancing requirements, there are no restrictions for attendees, customers, guests. I want you to, again, look at that asterisk there, because similarly to my last slide, Cal OSHA requirements do pertain to employees. So employees are not included in this list. Physical distancing at this time is still required. Masking is still required for right now for employee settings. But again, physical distancing no longer a criteria for people who come to see performances, live events. So vaccine verification and negative tests. So this is upon entry to the venue. So it's not required for most events, but it is required for indoor mega events. So outdoor mega events, it's a recommendation. But again, for indoor mega events, it is absolutely required that there's vaccine, proof of vaccine status and proof of negative test result. And then for face covering and masking, we ask that you just follow the current California Department of Public Health guidance for face coverings. So this link is an actual link that when you get these slides, you'll be able to click on anything that you see here in yellow. And then traveling, just to point that out, is we ask that you follow CDC recommendations around traveling. So this here, you see my light bulb, and that light bulb is just to indicate that a lot of people had questions around this. So I'm going to walk you all through this. So the question is, well, when is a mask required? When is a mask still required? So indoor public settings and businesses. If a person is fully vaccinated, which you see in that middle column there, there is no requirement that they wear a face covering. Now, taking you over to the right here, if the person is not fully vaccinated, a mask is required. So again, indoor public settings and businesses, no face mask required for people who are fully vaccinated. Yes, face mask required for people who are not fully vaccinated. Now, outdoor is a little bit different. So outdoor public settings and businesses, fully vaccinated people, no mask required. Not yet fully vaccinated people, also no mask required. So there are 5 areas where masks are required regardless of vaccination status. So public transit vehicles and hubs. So I have a note down at the very bottom just to let you know everything that includes. So it's AC Transit, BART, if you get on the plane, if you go down to Jack London Square and you get on the ferry, masks are required for everyone, regardless of your vaccination status. Schools and other settings, other youth congregate settings, masks are required for everyone. Healthcare, long-term care facilities, masks required for everyone. Correctional or detention facilities, masks required for everyone. Emergency cooling or homeless shelters, masks required for everyone. So something that I'd like to point out about those last 3 is that those are considered high-risk congregate settings where there's just a large number of people that are in a setting, a special setting where we're really just trying to make sure that we're protecting them or continuing to protect them. So regardless of vaccination status, a face mask is required. And then last thing, which I feel like I've said it 3 times and I'm gonna say it one more time, or probably a few more times, but I'm gonna say it again on this slide. Employees are subject to Cal Osha requirements. So you see that workplace is not included on here, and we'll talk a bit more about that later. But in this moment, on today, it is required that a face mask be worn in places of business, in workplaces. So another question you might have is, well, what is a mega event? You told me that proof of vaccination status is required for a mega event. Well, what is a mega event? So up top, I have events with 5,000 or more people indoors, and events with 10,000 or more people outdoors is considered a mega event. So I listed some examples for you all. So if you look at the column that says indoor mega events, you'll see conventions, conferences, expos, sporting events, so on and so forth. And then over on your right-hand side, you see something similar. So festivals, car shows, marathons, live performances and events, theme parks, and things of that nature. So the part that I'd like to point out, or just to reiterate, is it says pre-entry proof of fully vaccination status or a COVID-19 test result is required for all attendees. So all attendees, in order to attend a mega event, must show proof of either being fully vaccinated or tested within a 72-hour with a negative test result. And then on your right-hand side here, you see that it's strongly recommended. So not required, but still strongly recommended. It is a nice precaution if an event a venue or an event organizer is able to instate these guidelines. So one last point that's a little bit different for outdoor mega events is that venues are still required to make masks available for everyone who attends. And then again, CDPH guidance for face coverings. So we have another light bulb on this slide. So I'm going to stress that when I get to that point. But there's a question of acceptable options for proof of vaccination. So I'm hearing you say that there's mega events, and at a mega event, I have to make sure that everybody's been vaccinated or they've tested negative. Well, how can I make sure that this is done? So these are the 3 things that are acceptable. So the original Department of Health and Human Services, Centers for Disease Control and Prevention, COVID-19 vaccination record card, a physical or digital copy of that vaccination card. So that can be inside of a cell phone, that can be printed on a printer. So just basically a photo or some sort of illustration of them having had been fully vaccinated. And then the third option is a document directly from a healthcare provider. So a healthcare provider is able to provide a document that says, yes, this person has been vaccinated. So here, where the light bulb is, it's like, well, what exactly needs to be included? Like, how do I know that this is how do I know that I'm doing everything right? So there's 5 things that should be listed on the proof of vaccination: the full name of the person, their date of birth, the type of vaccine, the date of last dose, and then the vaccine site. So if I can just point out something around date of last dose, if you are a venue operator who decides to do the vaccine verification, for date of last dose, this is how you know whether a person is fully vaccinated. So full vaccination is 2 weeks after their last dose, or 2 weeks after the one dose if they got the one dose regimen. And then down at the bottom, there's a little note here, and it says that businesses and venue operators may also use self-attestation at point of entry at the point of registration, during ticket purchase, or on the day of the event prior to entry into the venue. So again, businesses and venue owners are able to use self-attestation, which means that you will not have to review full name, date of birth, type of vaccine, etc. So there are a few guidelines for implementing the mask requirement. So in settings where masks are required for some people and not for others, it's there's three major options. So a venue can either implement vaccine verification to determine if and which individuals are required to wear a mask. So that means that you're literally collecting, or not really collecting, but you could collect, but reviewing the vaccine card that I talked about on the last slide. So that is what a vaccine verification, you're absolutely verifying with your eyes or a computer system that this person has been vaccinated. That's an option. The second option is to allow vaccinated individuals to self-attest. So that means you're not looking at vaccine cards, but upon entry, a person is either telling you, yes, I have been vaccinated, by which they won't have to wear their mask indoors, or no, I haven't been vaccinated, by which they will need to wear their masks. And then the third requirement is just to make everybody wear a mask. So to require all patrons to wear a mask. So a business owner, a venue operator, a host is totally able to decide which of these options best work for them. And then a note that I have here is just that no person can be prevented from wearing a mask as a condition of participation in an activity. So that means that if I say that I'm fully vaccinated and I still want to wear a mask, you cannot deny my entry. We've gotten questions around, well, if a person is wearing a mask, then doesn't that mean that they've not been vaccinated? And that's not true. Not everybody's ready to take their masks off just yet. So if a person wants to wear a mask, they cannot be denied entry. So here's my my light bulb. So it's just, yes, you have the option to require. So this question came up quite a bit. A business has the option to require all persons to wear a mask if they so choose. Absolutely. So here are just some strategies to encourage risk reduction behaviors. So event planners should implement strategies to encourage behaviors that really just reduce the spread or the transmission of COVID-19 amongst both the staff and the attendees. So there are 5 points. Remind everyone to stay home if they have, or if they think they have COVID-19. So that's around isolation and quarantine. If a person thinks that maybe I could have it, don't come to the event, don't come to work, because you might transmit to other people. So just continuing to remind people of that. Continue to provide hand hygiene supplies. So hand sanitizer at the entrance, that can be an option, or continuing to supply it in areas where there might be high touch surfaces. So just continuing to allow people to sanitize their hands as much as possible while in your venue or your event. Requiring people who are unvaccinated to wear a mask during indoor events. So this is a requirement, but I put this on the slide really because it is a strategy to encourage risk reduction. So if we normalize the fact that unvaccinated people are required to wear a mask, it becomes the norm, and it becomes easier for us to continue to control the virus and the spread of COVID-19. We have increased ventilation or natural airflow during indoor events. So if there is an indoor event, we just suggest opening windows and doors as much as possible, just to maximize the natural airflow. We know that more airflow, less COVID-19 transmission. And then last but certainly not least, a strategy is to encourage people to sign up for CA Notify to receive exposure notifications. So this is a state platform where a person can register, and let's say I went to a restaurant this weekend and there was an outbreak in that restaurant, I would receive notifications that I may have been exposed to COVID-19, which will enable me to then go get tested for it. So we have just some considerations for musical performances. So It's important to take extra precaution during musical events, especially if they involve vocalists or wind instruments. There's a note at the very bottom of this slide that I'd just like to highlight, and it's just the fact that singing and instrument music by woodwind or brass instruments are thought to be a higher risk activity for COVID-19 spread due to the aggressive expelling of respiratory droplets. And we know that COVID is transmitted via respiratory droplets. So this can create aerosols that remain in the air for longer than an actual droplet. So again, singing and playing woodwind instruments or brass instruments can actually cause COVID-19 to hang out in the air for a bit more longer than we would like. So a few of the considerations are to avoid shared equipment. So if there's shared equipment that might come into contact with a person's mouth, such as a mouthpiece or a microphone, we suggest not allowing people to share equipment if you're a venue operator, or if you're a musician, a performer, just to have your own microphone. Cleaning and disinfecting shared equipment between uses is another consideration, or actually it's a requirement. You are required to clean and disinfect shared equipment. So if there's a mic that I'm using and I now need to pass it on to Rachel, that mic has to be sanitized. It has to be cleaned and disinfected before Rachel is able to use that before her performance. Considering disposable microphone covers for performers is also another consideration. And then if a performer is unvaccinated, ensure that they maintain physical distance from all persons. So performers, other performers, from the crowd, from the audience, from everybody. So if a person is unvaccinated and they're going to be singing at this event tonight, they need to maintain physical distance from everyone else. So I am going to now pass the mic to Pegah to talk to you a bit more about Cal Osha requirements.
Hi, Ieshia, thank you. Now for Cal Osha requirements. Next slide, please. As far as the Cal Osha COVID-19 emergency temporary standards, Cal Osha's board will be meeting tomorrow, June 17th at 10 a.m. The Cal Osha board will review proposed revisions to the COVID-19 emergency temporary standards, ETS, for workplaces, including mega events. If approved, the revisions are expected to take effect on June 28th. The governor may issue an executive order to implement that sooner. Until that's approved, businesses must continue to comply with current Cal Osha regulations that include requiring face coverings for all employees, regardless of vaccination status, establishing and implementing a COVID-19 prevention program, and physical distancing. For tools and resources, to find a vaccine appointment in Alameda County, sign up through Alameda County Alco Vax. You may also visit the Berkeley COVID-19 vaccine information webpage. You can book via California Department of Public Health, My Turn. Check with your current healthcare provider. Schedule at a local CVS, Rite Aid, or Safeway. And then you can also call 510-208-4829 for scheduling support. For more information, you can visit Alco Where to Get a Vaccine. To stay informed, so for COVID-19 vaccine updates that include eligibility and appointment information, there's also ways to stay informed with the Vaccine Community Advisory Board that occurs Tuesdays at 5:30 p.m. monthly. For Alco Healthcare Services Agency weekly COVID-19 updates, these will include presentations and newsletters. For Alco COVID-19 Workplace and Recovery newsletter, this newsletter will include workplace and employer updates. And then for Alco COVID-19 Guidance and Resources webpage, this will include local updates, data, and general COVID-19 resources. And for all of these, the links will be part of the presentation slides that we will send you, so you'll have them. Next, please. For employers, Alameda County and the city of Berkeley have an employer update coming up next week. So please join us Monday, June 21st from 6 p.m. to 7:30 p.m. for an employer business owner focused event to learn about Cal Osha requirements, workplace safety measure recommendations, and what it means to return to usual operations. Some resources. So below, you'll be able to find links to general resources, including the Alameda County Arts Commission, the Alameda County Beyond the Blueprint webpage, Californians for the Arts COVID-19 resources, the CDC Events Readiness Planning Tool, CDPH's Employer Vaccination Toolkit, and the CDPH Safer at Work Toolkit. And now back to Rachel to get us started on question and answers.
Thank you so much. These are just, go ahead and go to the next slide. Terrific job, everyone, on submitting questions in advance. And I see there's a number of questions in the question and answer chat, so I'll include those too. So I understand that Eileen's going to be answering the set of questions. And the first question is, will there be a requirement to wear masks indoors?
Thanks, Rachel. So yes, there is a requirement to wear masks indoors for all employees per the current Cal OSHA ETS. And then for patrons and general public who are not at a work site, but out in public or indoor businesses or other activities, unvaccinated individuals are required to wear a face covering while indoor at businesses. And then, as Ieshia mentioned on her slides, there is a requirement for face coverings regardless of vaccination status for certain locations. That includes on public transportation, indoors in K-12 schools, childcare and other youth settings, healthcare settings, and long-term care facilities, state and local correctional facilities, detention centers, homeless shelters, emergency shelters, and cooling centers.
Okay, thank you. Will there be a face mask requirement for audience members who do not show proof of being fully vaccinated?
Yes, if they are unvaccinated, for indoors, unvaccinated individuals are required to wear a face covering.
Okay. For activity that involves heavier breathing like dance, should adults still wear masks if vaccinated?
We would recommend folks who are fully vaccinated, and if they're involved in heavier breathing or like exercise, to wear a face covering, but we'll leave that up to the determination of the fully vaccinated person.
Okay. All right, here's a question that's in the chat. Can a venue require a person to unmask for the purpose of identifying the person? Like many venues, we have had people assaulted near our venue by other patrons, but in most cases, we were able to identify those people if they showed up again. It's not true if the individuals are masked up. So I guess this has to do with identifying individuals and sort of the anonymous quality of people wearing masks.
You could briefly ask folks to unmask, but because you're not sure of their back status, make sure that there's physical distancing. However, if let's say they're entering in a facility indoors at an event or a business, unvaccinated folks are required to keep their face covering on.
Okay. There's some general questions. I think I'm going to give them to you, Eileen, too. Is Alameda County the final authority on regulations, or can city governments, like the city of Oakland, set their own regulations? Do we need to check both county and city requirements or regulations?
Currently, Alameda County is fully aligned with the state of California in terms of COVID-19 restrictions, safety measures, guidelines. However, local jurisdiction can choose to be more restrictive than what is allowed by the state at this time.
Okay. Here's another general one. Do you expect Cal OSHA requirements to change? I think as early as Thursday.
So Cal OSHA will have their hearing tomorrow. There is a red line version of the proposed revisions to the ETS posted. That's the last Cal OSHA hearing when they discussed this. They were expecting this to go into place on June 28th. However, the governor has mentioned that he could and possibly will issue an executive order that will make it effective even sooner than June 28th. So we are not sure what that will look like. So we will also be monitoring that as well to figure out when that will kick in if the governor decides to issue an executive order to speed up that calendar process.
Okay, great. Thank you. Okay, should we go to the next set of questions? Let's see, Ieshia's going to answer these. What are the rules going to be regarding asking audience members, cast and crew about their vaccination status?
Yeah, so there are no like written out set hard rules in development. So with this, it's really based on the venue owner, the host to make that determination. So there are no rules set in place regarding asking audience members, cast, crews about their vaccination status. There was a slide that I provided, and there were I think 3 or 4 ways to get through vaccination. So you can look at the card, you can look at a photo of the card, you can have their provider give you a copy of that, or you can have them self-attest. So it's really up to you for how you decide to go about this. We would though encourage you to speak, if it's a larger organization, speak with HR legal team if you have that. And if it's a smaller entity or a smaller entity that doesn't have one, or you are everything at that organization, then I would truly rely on what it is that CDPH is telling us. And again, it's either self-attestation or looking at people's cards. One thing that I would like to point out though about vaccine verification is that it's not a HIPAA violation to ask people of their vaccine status. It is not a HIPAA violation. Lots of things are HIPAA violations. This one is not. The thing though is that it still needs to be in a secure manner. So that's to say, if I am doing vaccine verification upon purchase of the ticket, let's say I was using Eventbrite. Eventbrite, to my knowledge, might not be the most secure place for people to be uploading their proof of vaccination. So if there was like an encrypted system that you had, even email oftentimes can be encrypted to keep it safe because it is a person's health information still. So long answer, I know, and forgive me, but the answer, just to recap, is that there are no rules in place. Please review the slide that I provided that lets you know which documents are eligible for proof of vax, but then also consult HR or legal department if you have that.
Okay, thank you. Next question, can I limit anyone coming into the theater, whether audience, performers, staff, or backstage personnel, both local and traveling, to those who have been fully vaccinated?
So yes, you actually are able to do that. So if a venue says all folks who are going to enter my venue must have been fully vaccinated, then that is okay. That is absolutely okay and acceptable. The thought is that if all persons are fully vaccinated, there's a much lower risk of transmission. I do want to point out though that because vaccine, and not just COVID vaccine, any vaccine is not foolproof, right? It's not 100%. There's still risk for breakthrough infection. So it's not to say that having a venue and all people are vaccinated means that there's absolutely no risk of transmission, because that's not true, but it's certainly a good measure. So this is absolutely okay.
Okay, thank you. Next question, should I ask to see vaccination cards with corresponding ID? Or should everyone who enters sign an attestation, which is a main declaration of some type, and I think it means either verbal and or written. Is that true? But anyway, about vaccine card ID, and also what types of statements do you collect?
Yeah, so the should I sounds like advice. So I'm not going to go there. But what I will say is that I provided the 5 things that are required if you are going to be implementing a vaccine verification program. So you need to make sure it says the full name, the place they were vaccinated, the type of vaccine they received, their date of birth. And I'm missing one, but it's in the slides. So there's 5 things that must be on that document. So if it made you comfortable as an event operator to check ID to match that to somebody's vaccine card, it is absolutely that's your prerogative. If it makes you feel comfortable and safe, yeah, you can do that. I will say that I will, so I'm looking at the next part of the question, and it's around the attestation. So because it is self-attestation, which means that a person can say like, yes, I did, and no, I didn't. There's no way to control or monitor to dictate that. Having a sign can also serve as a measure for attestation. If there's a sign upon entry that says masks required indoors for all folks who are not vaccinated, and you can take your mask off if you are vaccinated, that is considered self-attestation, because when they walked in, they saw that sign and they knew that the rules applied depending on their vaccine status. So that is an option as well. So as far as signing a document, I mean, you could, it might get laborious. It might take a lot of time and energy. It's not required by the state, but if that is something that makes you feel comfortable, absolutely.
So just in summary, the attestation, I never use that term regularly, but I see that you all do. So it could be, could you just review? It could be like a verbal confirmation. It could be a written confirmation by signing something, or it could be
Signage.
a point of entry in which people are notified that by their entry and participation or something like that, that they are attesting.
Yes, correct.
Okay, question, can we retain the attestations on file to eliminate multiple attestations for those who may be returning? Example, staff.
So if this is a venue where you're going to decide to collect attestations, you could certainly do that. I just want to point out that it has to be done in a secure way. So while it's not breaching HIPAA, it's not a HIPAA violation to ask someone of their vaccine status. If you have some sort of attestation on file, you just still need to make sure that that is protected as per HIPAA requirements. So sure, you can retain attestation to maintain, to eliminate them having to do it over and over, but just bearing in mind that verbal attestation is also okay. So if you collected it, because I see for staff, so if you collected it one time and then they were able to verbally remind you, that's also okay.
Okay, I'm going to add a question in from the chat, which is a follow-up question, because I think that this person did a good job with asking again. So they said, thank you for answering my question. Following up, do you know the office at the City of Oakland we should check in with to make sure an event is complying with city regulations in addition to county regulations? So do you want to clarify that? Is there any expectation requirement to check in at a city level in relationship to the current guidelines? And if so, who would they talk to?
Yeah, so Eileen, can I punt that to you? My understanding is that for
Yes.
Alameda County, yeah, I'm gonna punt that to Eileen.
Yeah, if you're holding large events in, let's say, public spaces, you should be checking in with the cities and local jurisdiction, because there are certain permitting requirements that they will have in place. In terms of the City of Oakland contact, I'm not sure if Diane, do you know who the best contact will be at the City of Oakland?
Okay, well, I'll let somebody respond later, but Eileen, what does a large event mean? So you said if an organization is presenting or hosting, planning a large event, they should check in. What do you know what the definition of large is?
Oh, or any kind of event in public spaces, they should check with local jurisdiction for permitting requirement.
A public space is like a
Parks or
open
street, yeah.
Okay, so a public space, but if it's a private space or a space that they control, they don't need to check with the city?
They might, depending on the city. So this is even requirements before COVID. They might have to check with the city depending on that city's requirements for those different types of spaces as well, because they might have specific ones for private spaces. And I see Diane unmuted.
Yeah, probably where they get a permit. So it would be through the permitting process that they would check in on this.
Okay.
So even if you're having a big birthday party and you're getting a permit to use a city park, that would be the best place to check if there's anything else you have to do.
Okay, terrific. Thank you, Diane. All right, should we go to the next group of questions? Eileen is going to answer, I believe. What ways do you suggest keeping multi-generational audiences safe indoors?
So the first way is enhancing ventilation, as mentioned in the previous slide in the presentation. So if you have a current ventilation system like the HEPA, make sure that it's in high efficiency. If you don't have a system like that, if possible, open doors and windows to increase ventilation indoors. And then the second is ensuring that unvaccinated individuals or attendees indoors are wearing face coverings.
Okay, there's a related question in the chat that says, as a nonprofit community choir, we would like to start up performing again by holding concerts at senior centers and assisted living facilities. Are these considered healthcare settings? Is it facility dependent? Example is Merrill Gardens Assisted Living in Oakland.
A senior center is not. However, a senior center might have COVID restrictions in place, so you'll have to coordinate with them. Assisted living, skilled nursing facilities are considered healthcare settings. So there is the whole face covering requirement for everyone who are within those facilities, regardless of vaccination status. But there are different state guidances that regulate these types of licensed skilled nursing assisted living facilities. I'm not sure if they will allow for performers in those facilities because they are at higher risk of COVID transmission. So you should coordinate with that facility.
Okay, thank you. How can small performance activity spaces that cannot afford new HVAC systems be made safer?
As I previously mentioned, enhancing and improving ventilation by opening doors and windows if possible. Letting folks know those key principles that Ieshia talked about, like if you are sick or have a COVID-19 symptoms, please don't show up at the space. And then this is only a recommendation, not a requirement. So like providing hand sanitizer, encouraging people to wash their hands. So some of the same previous COVID principles that were requirements, but these are all now just recommendations. So recommendations does not mean you are required to comply with it.
Okay, terrific. What liability issues should artists and small nonprofits be most aware of and guard against?
Yeah, so artists, small nonprofits, or even large organizations, businesses, event venues, they all need to comply with the Cal OSHA's emergency temporary standards for COVID-19 prevention. And we know that there are still unvaccinated folks in our communities, and also there is COVID transmission. So COVID's going to continue to circulate. All that you could do is comply with Cal OSHA requirements. There shouldn't be any issues with that as long as you're in compliance. Might be issues if you're out of compliance, so Cal OSHA will possibly be doing inspections of it based off of complaints received. And then also speak with your human resources department.
Okay. How many performers plus staff will be allowed at public performances?
There are no capacity limits. All that has gone away.
Okay. What regulations would apply to smaller indoor venues and small studio performance spaces?
So those would be the Cal OSHA emergency temporary standards for COVID-19 prevention. And then when you talk small, I'm assuming it doesn't meet the mega events definition. So there isn't any restrictions in place for events that are indoor venues or performance spaces that don't meet the criteria for mega events. And then please also continue to comply with these state space covering.
Okay. Are there any physical distancing requirements regarding seating?
There are no physical distancing requirements for seating for events or performances. I think with the Cal OSHA, they're hearing tomorrow, they are looking at some physical distancing requirements for mega events, but focused on employees only.
Okay, terrific. I'm going to mention a couple of questions in the chat. One question is sort of about, it says, will we be able to teach music to kids in schools? So arts education programs for, I guess, in school and maybe after school programs at school sites.
There's no restrictions against that. However, the schools can choose to be more restrictive, so please follow up with the schools to see what they will be allowing. Also, CDC is looking to issue some school guidance, which CDPH, which is our state, is looking to be aligned with it. However, we haven't seen those updates yet, but our county also plans to be aligned with whatever this state approves based off of CDC recommendations in terms of school settings.
I think we're learning there's a lot of individual questions that people have to ask cities, perhaps, or schools or school districts. I'm going to ask this other school-related or youth-related question. Are there more details about rules for both marching and concert indoor bands? We are mostly all minors and want to know the rules for the ages of 8 to 17. Or maybe it's also best practices for like ventilation and activities during rehearsals.
Yes, and that sounds like it's a youth setting activity. So in youth setting, as mentioned in the previous slide, under face coverings, that is one of the settings where face coverings is required regardless of vaccination status. I would defer to the state's guidelines on it because they do have an FAQ around that. We can share that with you as well in terms of like school and youth settings and those types of activities. But also, as mentioned previously, for indoor spaces, please enhance ventilation. That includes opening doors or windows or making sure that your HVAC system is at its highest efficiency level. And then Cal OSHA requirements actually in their ETS also outlines ventilation requirements.
Okay. There's another question that's very closely related. It says, we are a small after-school youth choir, approximately 60 teens, perform rehearse inside of a church. Is this considered a youth congregate setting?
Yes, because it's all youth, so it's considered a youth setting.
Okay. And then one kind of general question, I'm not sure who's going to answer this, but I'm also curious. What happens when someone disrespects the rules and regulations during an indoor-outdoor event? Meaning like feedback on how to deal with, I guess, the situation.
That is up to the event or venue organizer. So if someone is not complying, let's say an unvaccinated person not wearing a face covering indoors, it's the same way as how you might handle other issues before COVID.
Okay.
So that could be asking the person to leave.
Mm-hmm. Okay. I know, but there are so many questions. All right, we'll keep going. Hopefully we could finish them up. Who is the host when the venue rents the venue to a promoter or presenter? I guess it has to do with also who's making the decisions about, the engagement of the staff, performers, or audience. Who's the sort of the decision maker, right?
Mm-hmm. So how I've seen venue operators do it that are renting out their facility, the venue operator will have some rules written down, like the state guidelines, and then they ask the event host, so the person who's renting out their facility, to sign to say that they understand that these are the requirements. And then it would be the event host that would be doing the self-attestation or the vaccination status checking, if it's like, and the face covering requirements. So it would be them who would be doing the verification.
Okay. Okay, one last one for Eileen and then we're gonna move on. Can you clarify the definition of an outdoor venue if it takes place in a tent? So is that considered an outdoor indoor event if it's outside but inside a tent?
Yeah, if it has 4 walls, it's considered indoors. I'm sure that fire has a definition in terms of like tents considered indoors and outdoors. So you might want to check with fire code, but be sure that even though if it's in a tent and has 4 walls, that's considered indoors, and even possibly like 3 as well. I'm going to recommend that you check with fire code.
That seems like such an important question. I guess I would encourage Alameda County Healthcare Services Agency to try to help us with that one, because that's seems like a really common question for arts organizations. Okay, but I hear you, Eileen. Check with fire. Fire. They would check. They would if they were going to check on that, and it's not with you. Tell me again. Where would they check? The code. The city. Is it a city code in relationship to what is
No, it's
considered outdoor, indoor?
Yeah, it's a California fire code in terms of like tents, because they're the ones who come and inspect them.
Okay.
So they can help inform you, like, is it considered indoors or outdoors?
Is
But
that
if you're
information on their website?
like, I haven't been to the California Fire Marshal website.
Mhm.
Possibly you might be in there, or you can contact your local fire department.
Mhm. Okay. All right, let's move to the next group. Pegah is going to answer questions about indoor-outdoor events. Will there be any restrictions for indoor and outdoor event spaces that hold less than 5,000 people?
So Alameda County is in full alignment with the state and its reopening guidance. For any event hosting less than 5,000 people, there are no restrictions other than following the California Department of Public Health guidance for face coverings, where masks are not required for fully vaccinated individuals. However, they are required for individuals who are not fully vaccinated. And employers are subject to standards set forth by Cal OSHA. And as Eileen and Ieshia have mentioned, Cal OSHA will be having a board meeting tomorrow, June 17th, to discuss proposed revisions to the COVID-19 ETS. And we will have specific workplace guidance at that time.
Okay, great. What are regulations regarding outdoor public arts events like at park and other outdoor spaces?
Yeah, so the only regulation regarding outdoor public art events are following current face covering guidance set forth by the state. This is true until an event becomes a mega event, which is more than 10,000 people for an outdoor event. At that time, there are specific protocols that venues must abide by, including a requirement that venues provide guests with a face mask. And we will have detailed and updated guidance tomorrow after the Cal OSHA meeting.
Okay, great. Will either indoor or outdoor events have any capacity restrictions?
So there are no longer any capacity restrictions for either indoor or outdoor events. However, public health protocols change once an event becomes a mega event, which, as a reminder, is more than 5,000 people for indoor events and 10,000 people for outdoor events.
Okay, terrific. Oakland First Fridays is a free and open event drawing more than 10,000 people and has food, cocktail lounge, live performance, interactive activities, including a zone for kids. The only requirements we see for us to reopen is to have masks available for attendees, but we'd like to know if there are any other requirements and recommended best practices.
Yeah, so outdoor events that draw more than 10,000 people, such as Oakland First Fridays, are a mega event and attendees are required to wear masks. As noted in the question, venues are required to make masks available to all attendees. Pre-entry proof of fully vaccinated status or negative COVID-19 test is not required, but it is strongly recommended for all attendees. And as far as Cal OSHA emergency temporary standards, there will be specific protocols set by Cal OSHA for employers and employees, and we will have this information tomorrow after the board meeting. Additionally, since there will be food and cocktails that will be served at events such as Oakland First Friday, venues must remember to be in compliance with environmental health standards and city permitting protocols.
Okay, thank you. From the question and answer chat, as an event venue only, not a event host, we are required, required to do anything beyond posting signage that unvaccinated guests need to wear masks, and that by entering our venue without a mask, a guest is self-attesting they are vaccinated? So I could read that again, essentially as, it says, are we required to, for example, to do one thing, which is have a sign posted, and that by entering our venue without a mask, that guest is self-attesting they are vaccinated?
Yes, I believe that is sufficient. And if Eileen or Ieshia have anything else to add to that, but as far as venues, they're just required to provide, if it becomes a mega event, they're required to provide their guests with face masks. And then as far as face covering guidance, abiding by that, whether you're fully vaccinated or not fully vaccinated, following CDPH face covering guidance.
I was looking at the chat. There's more questions about this, the tent with the 4 walls, but I think, okay, let's move on to the last page and then we'll have to wrap it up. Okay, Eileen, for youth programs ages 3 to 11, can there be physical contact in dance activities or should we maintain social distancing? Good question.
Sorry, I was answering questions in the chat. In the Q&A. So for youth programs ages 3 and 11, yes, physical contact can occur. The state does recommend that for these youth settings and school settings, they maintain 3 to 6 feet, but it's only a recommendation.
Okay, terrific. Should all children and teens who are unvaccinated continue to wear masks indoor while dancing together?
Yes. Because in youth settings, it's required for face coverings regardless of vaccination status.
Okay, terrific. How will Beyond the Blueprint impact non-site specific service providers, example, arts education venues, who travel from school to school providing enrichment classes?
Sorry, I'm reviewing this one. So there isn't any impact in terms of, actually, let me answer that again. So it goes back to it being a school setting, so they would have to comply with school youth setting requirements through the Beyond the Blueprint. So because they're a non-site specific service provider entering into a school, they will have to comply with those school regulations that's issued by the state. So that means face covering is required regardless of vaccination status. And there might be additional school requirements based off of the CDC recommendations that haven't been issued yet that the state plans to align with.
Okay. So I think we're at our time, we plan to end at 2 o'clock. Is that true, Ieshia?
That's the plan.
Okay. So I see there's lots of questions in the chat. So Ieshia and Healthcare Services Agency team, might you be able to collect those and then, I don't know, find out if we could synthesize them and answer them, and you could provide the information to me. I could try to share it with arts and cultural organizations in Alameda County.
Yeah, we should be able to do that. If I may, and I'm sorry, I think we might be really close to time. There's a question that I just wanted to highlight, and I provided a written response, but I think it's a really good question. So it says that the venue, so like it was around the question, when I said that your performer who's unvaccinated must maintain social distancing. So they're saying that I also noted that they may be spreading COVID to other people. Yes, about the liability. So basically, as Eileen stated, Cal Osha requirements are different from the state's requirements at this time. And the reason why the timeline is not adding up is because there's been a lot of review, right? So there's been a lot of having to go back and reassess what they've come up with, which is why the timeline's not accurate. So there's 2 questions that are asking that, like, why is it that a performer would have to continue to social distance, but the patrons don't have to? So it's really around keeping employers safe. And until they make a final decision, unfortunately, employees and employers are required to continue to do the old rules. So June 15th wasn't a thing for workplaces, is really where we're at, because somebody said, like, it doesn't make a whole bunch of sense. And I just want to let you know that we hear you. We know that, and that's why they're reconvening again tomorrow. And then to the point of it being a liability issue, as long as the venue is doing everything in their due diligence, they cannot control if there's some sort of transmission. So if I am fully vaccinated and there's a breakthrough infection, I told you I was vaccinated, but somehow I still transmitted, that is not your fault. As a venue owner, that is not your fault. You took all the steps required. It's a virus. It's smart. We're smart too. People are smart too, but we can't control it. So I just want to let you know it's the liability thing. You're not liable as long as you took the steps necessary.
Okay, thank you, because I saw some questions about that, and I think people appreciate that clarification. So, I feel like this was extremely helpful and valuable for everybody involved. I want to thank all of the Healthcare Services Agency staff and everybody who attended. I'm also wondering, Ieshia, could you quickly review where people could find more follow-up information, how they can maybe sign up to get updates? And then also, I'd just like to propose that perhaps we would have another one of these sessions sometime soon, because I see that there are so many questions that people had. So with that being said, Ieshia, could you review what sort of information and hypothetical next steps to get more information?
Yes. So here for the stay informed slide, and we're gonna get this. Probably I'll get this up onto the site by today. So toward the very bottom, there's two things that I'd like to point out. So it's the Alco Kovitt Workplace and Recovery newsletter. So signing up for that will allow you to continue to get updates. So when Cal OSHA makes a decision, whether it's on the 28th or before that, you'll be notified directly by us if you sign up for that newsletter. And then that last link at the very bottom is the resource guidance page. So that's where this presentation is going to be posted. That's where you can find out, like, do I have to wear a mask? Do I not have to wear a mask? So those last two are going to be the golden tickets there.
Okay, and then we will, the Alameda County Arts Commission will continue to partner with the Alameda County Healthcare Services Agency, and we'll try to continue to bring important and new information to the arts community. So with that, I want to say thank you to everyone who contributed to this event. Thank you for everybody for coming, and I just sincerely want all of you to know, all the artists and creatives and members of the arts community, how important you all are to our whole economy and community overall, and say thank you for your hard work and dedication and ongoing commitment to getting through this pandemic, to our future. So with that, I think we will say goodbye. Okay. Thank you.